Well, welcome. Tonight, we're going to meet somebody special, somebody who wants to help the area and Milford. So without wasting any time, let me start. Jess, how about an introduction?
Well, Al, first, let me say thank you so much for having me. I really appreciate the opportunity to be with you. My name's Jessee Mermell, and I'm running for Congress here in the 4th Congressional District. It's the Race to Succeed Joe Kennedy. We're on the ballot on September 1st, and I'm running because I want to take on Donald Trump and his minions. I want to fight for Medicare for all and a healthcare system that everyone can access and afford, including reproductive healthcare. And I want to lead an equitable recovery from COVID-19. I've built a 20-year career here in Massachusetts working on the issues that I think are so relevant to those goals, whether it's working on the front lines at Planned Parenthood, working side by side with Governor Patrick as a member of his senior team, in the trenches of municipal government as a select board member in Brookline, or the work I've been doing the past 5 years running the state's progressive business organization. I've spent my career focused on the issues that matter to working families in Milford and throughout the 4th Congressional District. And as we enter the home stretch of this campaign, the reason that you're seeing working families and leaders throughout the district coalesce behind our race, our campaign, is because I've put in the work. I've put in the work these past 20 years fighting for working families in Milford and beyond, and I'm asking for folks' vote on September 1st.
Sounds good. Jessee, I'll start with the question I always start with. Jessee, I'm from Milford. Why should I vote for you?
2 reasons, Al. Professional experience and lived experience. Like I just said, I've been in the trenches the past 20 years fighting on the issues that matter for the families of Milford and throughout the 4th Congressional District. It's not just that I support things like paid family and medical leave. I was on the 8-person team here in Massachusetts that negotiated the strongest paid family and medical leave law in the country. It's not just that I want better transportation infrastructure in our state. I literally have served on the Executive Committee of Transportation for Massachusetts and the state's Rail Vision Advisory Committee working on the front lines of these issues. I don't just support reproductive rights. I worked at Planned Parenthood. I don't just support investing in affordable housing. I was honored by one of the state's leading affordable housing organizations just last year for my advocacy in those areas. I've been in the trenches already doing the work to make life better for the people of Milford and the 4th Congressional District. And the reason I have such a passion for these issues is because I'm from a place just like Milford. You know, I've had the good fortune to live in Brookline these past 20 plus years, but I grew up in a small farming town in rural Pennsylvania. Actually, Milford is the big city compared to where I'm from. Just shy of 30,000 people in Milford now?
Yeah.
I'm from a town of 5,000 people. It was the biggest town in the county. I grew up across from a cornfield and next to a dairy farm. And I'm from a place that desperately wanted for attention and for opportunity. You know, Milford's a place with a lot going for it. The little town I was from, not so much. And I know what it means to be from a place where it feels like opportunity left you a long time ago. No one's looking in the rearview mirror to see how you're doing. I watched our friends and neighbors struggle. I watched my father try to figure out a path forward for the small business he ran, a hardware store a few blocks off of Main Street. I'm in these fights because my family's been impacted by them. My dear friends and the people I grew up with have been impacted by all of these issues. And so the fire I have in my belly for this work is rooted in deeply personal reasons. And so I can never leave behind anyone in the 4th Congressional District, any family or individual or worker in Milford. And it's why I'm in this race. And it's why I think the people watching this show and the voters of Milford should vote for me.
Now, tell us, you've done so much. What was your day job? How did you get involved in all these areas?
Oh my goodness. Well, you know, I'm in my early 40s, so I've had a few jobs along the way. Oh, let's see. I used to run as the executive director of the Massachusetts Women's Political Caucus, so working to elect women across Massachusetts to different offices. I was a select board member in Brookline, where my main focus was tackling climate change at the local level, working with some really remarkable local activists to do that. I ran external affairs at Planned Parenthood during the heart of the ACA debate, fighting for contraceptive coverage to be included in that landmark legislation. I ran Fair Test, the National Center for Fair and Open Testing, working on standardized testing reform in public schools and for college admissions. I was the state director of the Mass Association for the Blind and Visually Impaired, was Governor Patrick's communications director. And for the past 5 years, I've been the president of the socially responsible progressive business organization in Massachusetts, working on the ways in which we can tackle economic inequality and social mobility and create economic growth.
Wow. And at 40, you're still very young compared to an old man. Now,
well, I have to tell you, the campaign makes the grays come in a little bit faster. So, you know, we're doing the best we can.
Are you looking at your monitor? I would envy anybody with any hair. I wouldn't care if it's gray.
I think we both look great, right? It's a regular beauty pageant going on right now.
Thank you for that, but you do. I'm just old. Now,
no, stop.
Let's talk about healthcare. One of the areas that affects all of us. I don't understand some of the positions. You know, I've heard people come out and say, we're not going to cover people. And I always laughed because I've been on the show when I said, I don't know anybody that could stand and look at a young child who's sick and say, go away. I mean, let you talk. Healthcare.
No, Al, I so agree. Healthcare is a human right. How could you look at a fellow human being, child or not, and deny them the care that they need to stay alive, to stay well? And unfortunately, we have a system in this country where that happens far too often. And I would note that the disparities and the failures of our healthcare system we're seeing in such stark relief now because of COVID, right? We know that the system we have hasn't been working, but because of COVID, we've seen with even greater clarity the ways in which we're leaving people behind, the ways in which, particularly for low-income communities and Black and Brown communities, we're creating worse outcomes. And right now, at this moment, where our fates are intertwined, right? Al, your ability to stay healthy, to care for yourself, that impacts me directly. Just like my ability to stay healthy and take care of myself impacts you directly, right? Because of the global pandemic we're in. And so to have created a system where my ability to access healthcare or yours is in all likelihood tied to employment, and people are losing their jobs left and right. Millions of people have lost access to healthcare because they've lost their jobs at this exact moment where we need all of us to be able to stay well. I support Medicare for all. I think it's the best path forward for a system that everyone can access and afford so that we aren't laying awake at night worrying about the high cost of prescription drugs. You know, I'll tell you, my parents, they've retired to Florida. They're in their early 70s. And my father has been battling, I truly mean battling, prostate cancer for over 16 years now. And a few months ago, they told me just how much it costs them to take one pill of the many that he needs, and that doesn't count what my mother needs, to stay alive. It's astronomical. That's before they hit the donut hole. You know, when after that, it gets a little bit less, but still pretty rough. And he has no choice. He literally needs it to stay alive. No one should have to make that choice. No one should have to decide whether or not they're eating or paying their prescription drug cost, whether or not they're keeping a roof over their head or paying that bill. It's immoral and it's holding our country back. So I support Medicare for all. I'm not naive to the political realities that will need to exist to make it happen, but I believe it's the system that we need. One, to address the moral imperatives around healthcare, the fact that it is a human right, and two, to create a system that's fair and just and that saves us money. It's costing us $3.5 trillion right now to do nothing. So when we create a system that actually offers care to everyone, I think we're going to see savings and efficiencies, and we're going to be doing the right thing.
And that to me has always been an area when people say we're not going to cover everybody. Well, Jeff Hopkins is the head of our ER down at the Milford Medical Center.
Yep.
And he's told me point blank, he's never once gone out into the emergency room and said, do you have Visa or MasterCard?
Right.
When they're sick, he takes care of them. So, you know, I sit there and say, are you really saving any money when I got a sniffle, denying me routine medical care and waiting till I have pneumonia, and then I got to go visit Jeff at $2,000 or $3,000 a day?
That's exactly right. Where for maybe a few $100, right? Ideally less if we're doing it right. We could take care of your sniffle and stop it from becoming pneumonia. Now, that's not just saving money for our healthcare system. that's improving our economy, because instead of, taking off 2 or 3 weeks from work because you're really sick, maybe you're just taking a day or two off, right? To take care of yourself, to take that NyQuil, get a little bit of extra sleep, maybe some Tamiflu if you're really under the weather. And then you're back at work, right? You're back generating wealth for the economy, back putting money in your own pocket and supporting your family. There are so many additional opportunities to save and to create economic growth when we have a healthcare system that actually works for people.
Now, how do you answer the people who say we're paying for all these illegal immigrants and their health care?
So again, healthcare is a human right, period, full stop. And when you talk about undocumented individuals, listen, first of all, no human is illegal. These are people who happen to be undocumented. And by making sure that they are cared for and they are covered, again, we're not only doing the right thing, we are saving our country money in the long run. And your emergency room example bears that out, right? If someone can present themselves at their primary care physician or at an urgent care center and receive the lower cost intervention that they need before things escalate, that's good for our entire economy. That saves our healthcare system money, as opposed to presenting at the ER when things have gotten much further down the line and are more expensive to deal with. Again, it's costing us $3.5 trillion as a country right now to do nothing. So when we think about the cost of this, when we think about the moral imperative, we are spending a whole heck of a lot of money not changing a darn thing. And we could save money and get better health outcomes and do the right thing in this country by advancing Medicare for all.
Well, I remember a few years ago, we had to pay the visiting nurses to go in to a lot of the immigrants. And you got to remember, Milford, we started as immigrants. Well, we all did. Unless
you're from an indigenous family, we are all right. Children of immigrants.
We're all immigrants, but it was the Irish, the Italians, the Portuguese, the Brazilian, and we've all gone through, the stages. But one of the issues we were having was that TB started raising its ugly head, and the parents or the people we were giving the medicine to weren't taking it. So we had to pay a nurse to go in and watch them take it. And, everybody said, well, that's silly. You're spending money. And I said, really? Does your child go to school? If that person spreads a disease, whatever it is, to their children, the next day they're sending them to the incubator, and my grandson or my daughters are right there next to them. So it seems like some of this we're just doing to protect ourselves.
Listen, I would hope for most people it is because we all value each other as human beings, right? But you're right. There should and is a selfish motivator here. And COVID has proved it in spades. This virus, while we know is disproportionately impacting low-income communities and our BIPOC neighbors, anyone can get this. And so not just for TB or for COVID, it is literally in our best interest for us all to be able to access the care that we need.
Now, you seem to have been very involved in reproductive rights.
Yes.
I've always been curious. If I need a little blue pill, it's covered by insurance.
Yep.
But some of the other more basic issues aren't. How do you explain that?
I would explain it by looking at the gender makeup of lawmakers. We still have disproportionately large numbers of men in office. And, we all understand our own needs. That's just natural that we all are more familiar with, our own experiences. And so when you have more men in office, they have a more fundamental understanding of the reproductive and sexual health care needs of men. Okay. But we need more women in office, and we need more people that represent all sorts of diversity in office so that you show up with a lived experience that informs your legislating. And so, we need to make sure that all forms of reproductive health care are available. It is health care, pure and simple. I was the head of external affairs at Planned Parenthood during the heart of the ACA debate when we were pounding the pavement in Washington, fighting to make sure that contraceptive care was included in that landmark legislation. It's something that the Supreme Court just stripped out of the ACA a month ago or so. And it means that for low-income people who've been relying on that legislation to provide them with free or low-cost birth control, STI screening, cancer screenings, to quote Ruth Bader Ginsburg from her dissenting opinion in that decision, we're leaving women to fend for themselves. And why in the world that little blue pill would be covered and something as basic as birth control wouldn't be, to me, makes absolutely no sense and is just further serving to exacerbate gender inequities in this country.
Now, I understood way back when I asked the question, why are clinical trials so disproportionately slanted towards men? And one of the senior medical directors at a large pharmaceutical company came out and said, because they can't get pregnant. We don't know what would happen with some of these experimental drugs if a woman got pregnant while she was on it, and shades of thalidomide come to mind. But I sit there and say, wait a minute, every one of these men, I mean, I've got a wife, I've got daughters. I don't understand why I wouldn't want them taken care of.
It's another mystery. And again, a woman shouldn't have to be proximate to a man to value, right? We don't just have values as wives or daughters or sisters. We have values on our own as humans. But you're right. If there is a woman in your life who you love and care for, I would hope that you would want them to have the same excellent care that anyone else would have, the same medical expertise that's rooted in an understanding of a woman's specific healthcare. That matters. And I would note that it's particularly our Black and brown women who are on the receiving end of these medical disparities. And we've seen it from research study after research study that women are not often included in these research studies. Women are not often included in so much of the science that we need to make sound decisions, but it is particularly Black and brown women who are left out, and they see the disproportionate negative impacts of that.
It's amazing to me, because when you talk about Planned Parenthood, I remember us having this debate many times on the show, because it's all about they only offer abortion. They do nothing else.
Not true.
And when I have a liberal view show and a conservative. The conservatives are always destroying Obamacare. And then I said, well, I'm confused. I'm slow. If you do away with Planned Parenthood, and I'm thinking of Mississippi and some of the back areas, and you do away with Obamacare, where do these people go for basic medical needs? Because I look at Planned Parenthood as a plethora of different offerings, not just one.
That's absolutely right. I will tell you that when I first moved to Massachusetts, I was 19, 21 years ago next week. And, when you're a college kid and you haven't lived in an area before, you don't necessarily have a primary care physician. And so the first place I went for basic health care was Planned Parenthood on Comm Ave in Boston. And they provided me with affordable, high quality care. And it was fantastic. And a decade later, I was working there and saw firsthand the incredible care that they offer, everything from birth control to well woman visits to cancer screenings. They provide a range of absolutely necessary healthcare. That includes abortion care, which, by the way, is a part of healthcare. And what you're talking about is absolutely right. If people lose access to facilities like Planned Parenthood, they lose access to basic necessary health care. The detrimental impacts would be incredibly hard to measure because it would be health outcomes, but then all of the things that flow from that. And when you think about what happens when you close clinics, if you think about what happens when restrictions are put in place around the country around abortion access, let's be honest, mostly white women, well-off women will still have access to the care that they need. It's low-income women, BIPOC women, and other people who menstruate who need access to these services who will be negatively impacted. We like to say when I worked at Planned Parenthood that your access to sexual and reproductive health care shouldn't be an accident of geography or skin color. And as we see these restrictions proliferate around the country, that is what's happening.
But aren't we kind of spoiled? I mean, you talk about primary care. Most of the primary care physicians in Milford are closed practices.
Hmm.
They're at their maximum. You can't get in. So you turn around and say, well, I can go to the urgent care clinic. But I'm wondering, as you get away from the cities, my impression is a lot of men and women don't have access to all these extra clinics like we do.
There are huge problems when you get into rural America, no question. And there are parts of this district where, you would have to travel a little ways to find access to care. Heck, my primary care physician of nearly 20 years just retired at the end of last month. And I'm not quite sure what I'm going to do. I've been seeing her for years and love her. And the idea of, finding a new PCP and acclimating to one isn't something I'm excited about. I will confess that in the midst of a campaign, it's not something I've spent a whole heck of a lot of time researching and figuring out. That's on my to-do list for September 2nd and beyond, Al. But you're right. There's a real access problem because you know what? In Milford, if the doctor that you have as your first choice doesn't work out, they're closed, they aren't taking any more patients, you have a decent sized regional hospital right there, and you can probably look and see who else might be available. Or maybe you have to go 1 or 2 towns over, but assuming you have access to transportation and hopefully maybe some flexibility in your job, you have some options. But if you're in very rural areas, that is a major concern. And so, the reasons for our health disparities are many, many fold. And so we can't just do one thing to solve this. It has to be systemic change to fix the broken healthcare system we have in this country. I think a big piece of that systemic change is Medicare for all.
Now we're talking about pandemics. You mentioned COVID, big issue. I'm seeing it from both sides because I have a grandson who's going to school for the first time.
Oh, wow. High school or college?
Oh, no. This is 5 years old.
Okay. Little grandson.
Going to school for the first time.
I thought you were saying like going away to school.
Oh, no. But then I have a daughter who is heading up the Best Buddies program. And again, she came home one day and just said, Dad, I don't know what's going to happen because there's no way that some of my special needs kids, and she loves them dearly, can hold a mask on. They won't do it maliciously.
No, of course not.
But they don't have the attention span to focus on that. Or she says, my son Chase, they're going to sit him in a desk for 7 hours and say, don't move. What can be done?
We have to put public health first. I've been endorsed in this race by the Mass Teachers Association, the National Education Association. I haven't talked to a single educator who isn't so anxious to get back in the classroom, to be with their kids, to be able to lay eyes on them, to be able to teach in the way that they've always known how. I haven't talked to a single parent of school-age kids who isn't anxious for classrooms to be reopened. I will confess, I've talked to a few kids who are enjoying not having to go, not having to go to school every day. I know what a pressing issue this is. I know we can't successfully reopen our economy without figuring out both early education and care and schools. But I fear that we'll be asking our educators, our administrators, our students, and all of their families to be guinea pigs in a massive public health experiment if we reopen too soon. And we're seeing around the country some other school districts that have opened that go back before Massachusetts does, that within 2 or 3 days, they're shutting back down and going to remote learning because they're seeing clusters of COVID pop up. And so I think we need to be very careful. I think we need to open remotely to the greatest extent that we can at the beginning of all of this, and then transition as we start to get the virus more under control, hopefully when we have a vaccine, to remote learning, to mixed in-person and remote learning. It's such a hard question. It's not something that I say lightly because I understand, particularly if you're a working parent, particularly if you're a single working parent, the problems that this is putting in place. I understand the ways in which remote learning can and is exacerbating inequities in our education system, but we have to put public health first. We have to get this virus under control. And, Al, what you talk about with your daughter and some people with special needs is very, very real. And we've been talking a lot in this campaign about the ways in which we're failing to collect data for people with intellectual and developmental disabilities about the impacts of COVID on them, and to be able to fully understand how vulnerable those populations may be to the spread of disease and the ways in which it impacts their body. So there's just so much that we don't know, so many answers we don't have, so many solutions that we don't have. And I think we need to proceed with the greatest of caution.
I just don't know how they do it, because when you look at
a 5-year-old, because you've met a 5-year-old, and
right.
You know they're not sitting in that seat and keeping that mask over their face.
I can't imagine my little micro terrorist who I love dearly sitting still for 6 hours.
What is your micro terrorist's name?
Chase.
Chase, you said that already.
We went out and bought him, the KN95 masks.
Yeah.
And we bought a case of K or whatever it is, the N95 masks. Yeah. So my daughter has them, because we weren't sure the school's going to be able to provide them.
Which is a problem in and of itself.
But again, you sit there and say, I'm lucky. I could squeeze a few pennies here and there.
That's right.
But that dang case of N95 masks was either $300 or $600. And you think about it, people like my parents who were workers, they couldn't easily just say, well, we'll just go spend $300 or $600 bucks.
That's a lot of money for anybody. And particularly if you're out of work or you're seeing your income reduced because of all of this, that is an unfair burden to place on anyone. And the schools don't have the money to pay for it, because let's be honest, there's a bill that's been sitting on Mitch McConnell's desk for months now that would have provided trillions of dollars to pay for just the type of mask that you're talking about for Chase. And instead, Mitch McConnell is letting that rot on his own desk.
But what can you do? How do you get Congress to move?
You elect different people in November. That's the answer, right? We get rid of Mitch McConnell. We get rid of Donald Trump. We elect Joe Biden and Kamala Harris. I would argue that in the 4th Congressional District, you elect someone like me who's going to go fight for these things. But really, the answer is in elections. We know that this is a political problem. It isn't a problem of science. It isn't a problem of planning. It is a political problem with politicians who are putting profits and elections over people's lives, putting all of us at risk.
Well, now, I am so tired of not enjoying watching the Democratic Party or the Republican Party, because they both seem too extreme to me. Instead of coming together and working out problems, it seems like, moving the donkey forward or moving the elephant forward is more important. How do you go about changing that, except changing the people?
So let me tell you a story. 2 years ago, I was on the 8-person team that the legislature here in Massachusetts asked to come together to try to negotiate a compromise around paid family and medical leave. I was running the Alliance for Business Leadership at the time. It was the state's progressive, socially responsible business organization. Still is. I just happen to not be there. I left to run for Congress. Sitting on the same side of the table as labor and social justice organizations and other business groups with, different worldviews, more conservative, were sitting on the other side of the table. And Al, on day one of those negotiations, one of my friends from a more conservative business group literally asked what the problem was that we were trying to solve for. And I kind of wanted to hide under the desk, because I thought, if you don't understand what the problem is that we're trying to solve for, right? If you don't understand that families in the 4th Congressional District and around the state are going through the natural ups and downs of life, right? The highs of starting a family and you need to take time off to deal with that, or the lows of being sick, or God forbid, someone you love being under the weather and ill, and you need to care for them or be cared for yourself, and not wanting to face financial ruin just for going through those natural life events. Like, if you don't get that, what are we doing in this room? How are we even going to find any sort of common ground? But I have to tell you that over the course of 7 months, it was a long and arduous process. We were able to identify areas where we agreed, areas where we didn't agree yet, but we were closer together than you would have imagined. And then, yes, there was a subset of areas where we didn't agree and we had a lot of work to do. But we built trust and relationships, and we tackled the easier issues, used that momentum to apply it to the tough stuff, and we managed to reach compromise on every single issue in front of us. And we presented those compromises to the legislature. They were accepted with very few changes, actually rolled into a larger piece of legislation, but our piece was hardly touched, passed by the House and Senate, signed by the governor. It's being implemented right now. And by the time it's fully implemented at the beginning of next year, it will be the strongest paid family and medical leave law in the country. So when you ask about how someone who's going to Congress to represent this wonderful district, to represent Milford and the surrounding communities, can show up in a city, in a house where things are so divided and people can't seem to get things done, even when they disagree, I think experience like that matters. And I get it. That's not going to work out every single time. We're not going to be able to apply that same model and have that same success on every single issue. But I've been in the trenches. I've been in that exact situation where you don't even agree on the problem on day one. And after 7 months, with a lot of blood, sweat, and tears, and because it's Massachusetts, a lot of boxes of Joe and a lot of munchkins, we walked out of there with legislation that lifts up working families, that tackles racial inequity and gender inequity, and makes sure that working people have some security in their lives. And that's the approach that I want to bring to Washington.
But don't you feel, being in Massachusetts, we're a little spoiled? You know, I think about how happy I am that it's hard for me to tell the difference between a conservative Democrat and a liberal Republican in Massachusetts. Because they both seem to be the kind of people I want to vote for, in the middle.
Yeah.
Going issue by issue. I look out to the square states, and boy, that is bright red like a suntan nobody's ever seen. You know, or you roll the dice all the way to California, and it's so blue that they both scare me, though. You know, both extremes.
Well, we're certainly fortunate to be here in Massachusetts, but I'll tell you, those extremes exist here as well. You know, I've worked in them and seen them. And as someone who's, you know, proudly progressive, proudly on the left, I think it's still very, very possible to work with people with whom you disagree on issues, but have a shared commitment to try to find a solution. I do want to be really clear that I think there are some instances where differences are fueled by hate, right? If your difference with me is in how do we fund improvements to the commuter rail, right? And Al, maybe you want to fund it through mechanism X and I want to fund it through mechanism Y, then I'll sit in a conference room with you all day and roll up my sleeves and try to find a compromise. But if your difference is fueled by, you know, racism or anti-Semitism or sexism or ableism or any other form of hate, then I think we need to draw the line, because validating that worldview isn't something that's okay. And so when you talk about that type of extremism, the extremism that's really fueled by hatred and by discrimination, we have to draw a line there. But if your difference with me is fueled by some sort of, you know, policy angle, then I'm always willing to have that conversation. And I know it won't work out every time, but it's work that we have to do and see what sort of compromise we can come up with.
But that's the old Tip O'Neill, Ronald Reagan model. You know, in the House, in the Senate, in the White House, wherever they went, they were diametrically opposed in their political views. But you could see they respected each other. And they knew that somewhere along the line, they're going to have to compromise or nothing gets done.
That's right. And listen, I know what my core values are. I know what I'm not willing to compromise on, right? Every person has that. What is just at your core that you aren't willing to deviate from? And that's incredibly important. You need to have that, as my mother would refer to it, stick-to-itiveness, right? Understanding what's really important to you. But I'm going to Washington to get things done, not to deviate from my core values, but to get things done. And, you know, I mentioned when we started talking that I'm from this little town in rural Pennsylvania. It's one of the reddest parts of a very, very purple state. And I'll tell you, I don't agree on many issues with a lot of the people I grew up with, a lot of the people who live back where I grew up. Doesn't mean I don't love them. Doesn't mean I don't respect them. Doesn't mean that we can't have productive conversations and try to find common ground. And I think that in some ways, as someone who will be representing one of the bluest districts in the country, having my personal roots in a place where, you know, we got the first day of doe and buck season off from school because everyone over the age of 13 would be out in the woods trying to bag something. I think that matters. I think that's an unexpected twist in my background. And I think it's going to make it, it's going to create some common ground. And I hope make it easier for me to have conversations with people who might expect that, a liberal woman from Brookline, Massachusetts, would have a very, very different approach coming into those conversations.
Are we that blue in the 4th?
We are. We're one of the bluest districts in the whole country.
Because, I always thought Richie Neal, when he used to come on the show, talked about his banana district, because you had the Blackstone Valley, which had most of the 12 Republicans in the state coming in. But I didn't know we were that blue.
We're very blue. There's certainly some moderate pockets, for sure. There are a handful of communities that Donald Trump won, but when you look at it on average, we're one of the bluest districts in the country.
See, I call myself purple because being on the finance committee in my town, I get hit from both sides. The blue people say I'm too fiscally conservative because I'm actually proud that for 13 straight years, we've had a surplus.
That's great.
Not a big one, but a surplus every year. And we've taken care of everything we need and put away $30 million in case we get in trouble.
Yep.
So they won't accept me. Now, the red people don't like me either because they say I'm too socially aware. So I gave up and I just started laughing and said, okay, I'm going to declare myself purple. And the only one that's called me out on it is young Joe Kennedy, who said, you're purple because of Holy Cross, not because of Cross.
Well, listen, that's the joy of municipal government, right? I spent 6 years on the select board, years before that on the library trustee and in town meeting. It's the stuff that people see when they walk out their front door in the morning. So people take it really personally. And listen, we had a AAA bond rating the entire time I was on the select board in Brookline. So I totally get it. That commitment to making sure that your town is fiscally sound is really important. It's what allows you to make the investments that a community needs, right? If you have a good bond rating, you can borrow at a better rate to invest in schools, to invest in parks and open space or housing. So I get it. It's all tied together.
Now, you talked about the isms. We've had a Black Lives Matter rally, parade, whatever you want, a demonstration. And I felt really proud that the people in Milford started at one end, marched through the town, holding up their signs, and then when it was over, they went home.
Yeah.
To me, that was something I could, whether I agree with it or not, you couldn't pick on the people for, if they started looting or whatever, I don't know that I could support that.
Yeah.
But that pesky First Amendment does give me the right to voice my opinion as long as I'm doing it peacefully.
Yeah, well, certainly the First Amendment is a wonderful thing. Listen, we see around the country that Black Lives Matter protests have been peaceful. Now, in some instances, late at night, we're seeing examples of outside forces coming in and starting trouble. I marched in Medway marches, not far from you. It was a beautiful day. Black Lives Matter event that marched through town and ended with a big, beautiful rally in a park with music and families and art. That is exactly the type of thing that I have seen throughout the 4th Congressional District. I've been at Black Lives Matter events in Fall River and in Dighton, where Donald Trump won, I would add, and in Newton and in Needham and in Easton and in Brookline and in more communities than I can count at this point. And every single one of them, every single one has been peaceful, with families, with children, with people standing up and saying plain and simple that Black lives matter. And I think the more we talk about that, the better, particularly when we look at, quite frankly, a very, very white district, communities that in many cases are having protests along these lines for the very, very first time. When I was in Dighton, I was talking to the chair of the select board there. He was saying this is the first time he can remember a gathering like that in Dighton, and for hundreds of people to show up and line the road and declare that Black Lives Matter, to stand up for their Black and brown neighbors and Black and brown people around the country was incredibly powerful. And I'm sure that so many people had the same incredibly powerful and moving experience in Milford.
And that's hard for a lot of people because I can't say I understand what some of the inner city low income people have gone through, whether Black, brown, yellow, green, polka dot, the frustration. I can't tell you. I've never worried. Thank God, I've done okay, but I've never worried about feeding my family.
Yeah.
I don't know how I would react if I had to worry about my daughters walking out my front yard and getting shot, like I read about in Chicago.
That's right.
So
and it's our job as white people to do everything we can to educate ourselves and to try to understand, knowing we can never fully understand, right? You can never fully understand another human being's experience. But BIPOC Americans have been telling us for generations about their experience of systemic racism, being discriminated against, facing violence, as you talked about, for just walking out your front door. I mean, we saw last night another act of police brutality in Kenosha.
A guy got shot in the back?
7 times in the back, in front of his family, in front of his children. It's atrocious.
But Jessee, I learned things even at my old age. My inherited son's car went in the shop. Mm-hmm. And I laughed. I said, my daughter's car, she's in Boston. She's not driving it. Just take that one. Don't go rent one. And he looked at me and said, Mr. C, that's really nice, but please have bail money ready. And I said, what are you talking about? He goes, DWB. And I looked at him, I said, LMNOP. What are you talking? I had no clue. Yeah. You know what I mean? And that's when he told me that he's 6'8", black man driving a car that says Emily.
That's
and it's
right.
a Lexus. And I'm going to get attention. Yeah.
And it is white privilege, yours and mine, that for years allowed us to not understand that, right? I know I'm running for Congress, and it seems strange to say I'm a private person, but I'm actually a really private person. But my longtime significant other is a black man. And as aware as I thought I have been about racism and microaggressions and all of these issues, being in a relationship with him and being proximate to what his lived experience is as a black man in America, being pulled over together one time, or we flew to Florida to visit my parents and he forgot a razor. He's talked about this publicly. I'm not sharing anything he hasn't shared publicly. And was incredibly anxious that we make it to the store and find a razor so that he could shave before we got on the plane to come back. And my parents kept saying to him, you're with family, just relax. You don't need to worry about a little stubble with us. And similar to, the conversation you had about the car, he said to my parents, you don't understand. I'm a black man in the South in a community where I don't know people, and I'm about to get on an airplane. I need to be clean shaven. And so we have this privilege as white people to be in many ways ignorant to those types of concerns. And it's our responsibility as our friends and neighbors, and like you and I, our loved ones, are sharing these experiences to educate ourselves, to understand, and to lead with empathy, and do whatever we can to right these inequities that have plagued this country for over 400 years.
But see, your partner, my inherited son, I don't look at Chris as a black American. I look at him as an American who happens to be black. He could be brown, he could be any color. He's still my Chris. He went to school with my daughter, and he's become part of our family.
Yeah, and Pratt is my Pratt. But what I'll say is that when, as white people, we advance a narrative of not seeing color, I think we run the risk of wiping out the stories and the truths that people of color are sharing with us, because they don't get to walk through the world without color, right? My Pratt, your Chris, they walk through the world as black men every single day. And so to say we don't see color in some ways discredits or abandons.
Yeah, and you got to be sensitive, because I never thought of it. Mm-hmm. I guess that's a good thing, but I never thought of him as a black man who's in America. I mean, he was born in Virginia. He's an American.
Of course.
End of story.
He's an American, but also a black man who has a very different experience than what you and I will ever have.
Until they share that with us, I mean, I guess I'm lucky that I didn't know.
And that's privilege right there.
Immigration.
But I'll say, now that, people like you and I have a little bit of window into these things. It's our job to continue to educate ourselves, not just to ask, Black and brown people to constantly be sharing and making themselves vulnerable,
Right.
sharing their souls. It's our job to do the research, to have the conversations, to educate ourselves so that we know better and do better.
Well, let's finish up with defunding police.
Yes.
What does that mean?
To me, it means investing in community safety, right?
Thank you.
We know that law enforcement isn't the only way to keep a community safe. So I'll tell you, if your house, God forbid, is broken into and you call 911, I want a law enforcement officer to show up and respond to that call,
Yes.
right? If you're calling 911 because someone is experiencing a mental health issue or something related to homelessness or addiction, I want a social worker to respond to that call. They're probably going to have the best training, the best experience, the best know-how to respond to that situation. And that feels appropriate. I look at what a community like Eugene, Oregon started doing about 30 years ago and reallocating funding that had been going to, armed law enforcement officers and sending that funding to social workers for instances like the one I just described. I also think we need to define public safety in the broader community sense. So, you're involved in municipal government. You know that things like good quality housing contribute to public safety. A healthcare system that works for everyone keeps people safe, right? Good quality education is a public safety issue. Same with transportation, parks, and open space. Anyone in municipal government knows that well-maintained public space is part of public safety. So when I think about defunding the police, that's what I think about. How do we invest in the broader definition of community safety?
And see, there I'll agree with you, because when I hear we want to take money away from the police, I sit there and say, every time the police chiefs have had a squeeze funding, first thing that goes, training. And you sit there and say, wait a minute, no, that ought to be the last thing in my mind that goes. So taking money, you just carte blanche, taking it away and not investing it seems counterproductive to me.
Yeah, but do we need, a heavily militarized police with leftover military equipment being sent to municipal police departments? No, I don't think we need that. That's not money that we should be spending. I would rather see that money spent on our education system. That's the type of conversation we mean when we mean defund police. In Newton right now, there's a conversation about filling a handful of vacancies or working to, and unfortunately this vote has happened, so the conversation is over, but it was not filling some existing vacancies that existed for over a year, or finding a way to invest back in educators who were at risk of being laid off in the midst of COVID. To me, spending money on those educators right now instead of on the police department, that's what I mean when I say defunding the police.
See, we ran into a big debate about putting a SWAT team in Milford. And I don't know what level of arms the police should carry, because I'm not running into a hot situation with gangs with guns. So I do not have an educated opinion on that. I just remember when we were told that the average school shooting is over in 18 minutes. And it takes 42 minutes to get our regional SWAT team to Milford. At that point, scared the living heck out of me. Yeah. So hiring 4 new cops, having one in all the schools, felt safer to me. I don't know why. I don't have data, but if it's going to take 42 minutes for somebody to show up and it's over in 18, it didn't seem right.
Yeah. So I would push back on cops in schools. There's been lots of problems with that and the ways in which it's disproportionately impacting Black and brown kids, the kids who are being punished, the kids who are being singled out. Listen, there's no question that we need to make sure that we're keeping kids safe in schools, but the gun violence issue isn't limited to schools. And in fact, it's more likely to be an issue of suicide. It's more likely to be an issue of violence in the home or violence in the community. So I think we need to have a broader conversation when we talk about gun safety. And I have to say, I'm not comfortable with the idea of cops in schools. We know that that's disproportionately leading to worse outcomes for Black and brown students.
Well, now gun safety. Give me your opinion. What are we doing on gun safety?
So I'm really proud that I have the Moms Demand Action gun safety candidate seal of approval. We've talked about where I grew up. It was very much gun country.
Now, what part of Pennsylvania did you come from?
The northeasternmost corner. It's about 45 minutes northeast of Scranton.
Oh, okay. I was saying up the Scranton area.
Yep, that's exactly right. Scranton was the big city. We went, maybe 2 or 3 times a year for Pizza Hut and a movie.
I had family in Allentown and Bethlehem, so I
sure.
wasn't far away.
Even further south, but I know exactly where you're talking about. Listen, my dad had a separate freezer in the basement for venison and whatever he, managed to get for himself when he was out there during hunting season. So I have a lot of respect for people who hunt and use guns for sports endeavors. But I think we have a gun safety crisis in this country, and there's common sense gun safety legislation we have to pass. I think we need an assault weapons ban. I think we need to reauthorize the Violence Against Women Act so that people can feel safe in their own homes. I think we need universal background checks. And I think we need to make sure that we're holding gun manufacturers accountable when we see things like mass shootings and modified weapons. And we need to ban something that I've only recently learned about, ghost guns, when people assemble guns from a hodgepodge of parts, and they're very, very hard to trace and unfortunately readily available for sale. So I absolutely understand that people want to have access to guns for defense or for sport, and I respect that greatly. But we have an epidemic in this country that isn't seen anywhere else around the world, and it's because of our failure to legislate appropriately around gun safety. And again, I'm really proud to have the Moms Demand Action Gun Sense candidate seal of approval in this.
Now, you mentioned background checks. I am totally confused. If I want to buy a gun because I want to go hunting or do something, I go down to my police station, I get my FID card, I go through the background check, and next week I buy a gun. I see nothing wrong with that. I don't understand why I have to buy one. It's Saturday. I need a gun today. That scares me more than anything.
That's right. And this is the common sense part of it, right? Gun owners feel the way you feel, right? Oh, yeah, you want me to buy a weapon that could do real harm, and you want to verify that I'm going to be a responsible gun owner and it's reasonable for me to own this gun? Absolutely. Makes all the sense in the world. What steps do you need me to go through? Unfortunately, we have a Congress and a White House that's in the pocket of the NRA, specifically the Senate and the White House. And the NRA does not represent the sentiments of most gun owners, the sentiments that you just expressed. These are common sense measures to keep people safe. I'm not saying, Al, you can't have a gun. I'm just saying, let's make sure that it's going to be safe for you to have a gun before we give one to you. And if that means waiting a little bit of time, that feels very, very reasonable for me. And so closing those loopholes, making sure they're universal background checks, is something that will keep all of us safe.
Like I say, if I run in and say, I need a gun immediately, that's more of a red flag to me than anything.
There's probably something bigger going on.
Tell me about housing.
Oh my goodness. I mean, it is a moral crisis and an economic crisis. There's no question that we have a real housing shortage in this region, and that it's holding our economy back, quite frankly. Running the state's progressive business organization these past 5 years, we worked hard to organize socially responsible business leaders to make the case that if we don't invest in more affordable housing in Greater Boston, we're going to run into an economic brick wall. I can't tell you the number of CEOs that I worked with who said we are losing out on top talent because we don't have affordable and workforce housing. I remember one person telling me they had offered a woman from Buffalo a 6-figure job, a really good job at a big company. And she was ready to accept. She had come out here to look for housing. She was going to move to Boston or the Boston area with her son. She got out here, started looking for housing. Again, a 6-figure job. And she turned the job down and stayed in Buffalo because she just couldn't afford it. And that's a story that I heard time and time and time again running this big business organization. So there's a lot that we need to do.
My brother-in-law was offered a job. He's down in San Antonio.
Yeah.
Up on the North Shore. And he's making good money. He's making a couple $100,000 a year. And when he got up here, he said, well, now I've got a 3,600 square foot house. Mm-hmm. I know I paid almost $200 for it. I figure I have to go up to about 250 here. What can
Oh
I
my
get?
goodness.
And they said around Boston.
Yep.
And that kept him from coming. I mean, right now, Jessee, I know I can hire anybody from the coast or the East Coast, West Coast or East Coast. But it's almost impossible to get somebody to move from the square states because they can't afford it.
Yeah, listen, my brother and his family live just outside of Charlotte, North Carolina, just over the border in South Carolina. When I look at what they paid for their, beautiful house with a little yard and new appliances, and I mean, it's not a mansion or anything, but it's a nice house for their, family with 3 kids versus what I paid for my 477 square foot 1-bedroom walk up in Brookline. I mean, it's absolutely nuts. And if we don't fix it, number one, housing is a right? Everyone has the right to have a safe roof over their head. And it's also an economic crisis. I can't tell you the number of stories I heard, just like the one you told about not moving here from San Antonio, not moving here from Buffalo. Smart people who could be contributing to our communities, who could be contributing to our economy. And so, there's a bunch we need to do. We need to increase the low-income housing tax credit. We need more funding for Section 8 and Section 202. We need to invest in the affordable housing that already exists to make sure that housing stock is up to snuff. And we need to hold HUD, Ben Carson and Donald Trump accountable for the ways in which they have allowed for more housing discrimination for Black and brown people and for the LGBTQ plus community. We have a housing crisis and we have to solve it.
Jessee, but it's time for me to say, Jessee, I'm from Milford. Why should I vote for you?
Well, Al, first, thank you so much for having me on tonight. It's been a real pleasure. I think Al from Milford and anyone else from Milford should vote for me because I'm the candidate who's the proven progressive in this race. I've spent the past 20 years already fighting for the families of Milford and beyond and delivering, whether it's on healthcare, whether it's on economic growth and fairness, whether it's on reproductive health, whether it's on transportation or housing or so many of these other issues. I've been in these fights and winning. I have built this muscle here in Massachusetts, and I want to go to Washington and flex it in service of the people of Milford and the entire 4th Congressional District. We have real momentum in this race. In just the past few weeks, we've been endorsed by Maura Healey, Suzanne Bump, a host of local elected officials up and down the district. We are now on, I think, our 23rd union endorsement. Everyone from the Mass Teachers Association, Mass Nurses Association, SEIU, and so many others. And these organizations and leaders are coming together around our campaign because I have the track record, the experience, the values, and the commitment to address the issues that are facing working families in Milford and beyond. I'm grateful for the chance to have been with you tonight, Al, and I hope to have earned your vote on or before September 1st and the votes of your viewers.
Well, we thank you for coming on, and we hope that after September 1st, we'll have you back.
I'll look forward to it.
Then when you go to Washington, you won't forget us.
How in the world could I forget you? This has been a great conversation.
And as always, to our 6 loyal viewers, I've never asked you to vote for a specific candidate, but I've always begged you to get out and vote. It's so important that you pick somebody who you believe in. So to everybody who's watching, may God bless. May tomorrow be a better day than today. And Jess, thanks for coming on. Good night, all.
Sure.
Not too long since I've been home. Been running all my life just searching for my soul.